We are back with Dr. Sierra Windsor talking about MCAS. We did previous videos in regards to what symptoms look like with MCAS, what things make us consider diagnosis, and what labs we might run in relationship to that. And now we're going to talk about treatment options. So what things people use for first-line treatments, and then what happens what do we do when those treatments don't work? And also, are there any other options besides medications that we might consider using? Mm-hmm. Okay, great. So let's start off first with, what is your first-line approach to treatment for MCAS?
Mm-hmm. First line, and I think something most people have probably already tried, is going to be the antihistamines. And I normally use those more so if we're trying to test how much histamine's playing a role. And the reason you start there is because they're cheap, they're over the counter, they're safe, they're generally well tolerated, and you're going to know really quickly if just blocking that receptor and blocking histamine and the effect of histamine, how many symptoms can we determine are from histamine. So it's the nice quick screening tool.
Okay, and what antihistamines would we use in that regard?
Yeah, so usually I would pair an H1 and an H2 blocker together because there's 4 different histamine receptors and we only have medications for those 2 right now. They're working, I think, on H4 blockers, which will be interesting. So H1 blockers are Claritin, Zyrtec, Xyzal, hydroxyzine, those kinds of things, Benadryl. H2 blockers, the best one is Pepcid or famotidine.
Mm-hmm. And those are easy over-the-counter medications.
Yep, they're cheap and pretty safe to try.
Basis. Okay, so then if we try antihistamine types of approaches and say it is effective, then what does that tell you?
Mm-hmm. It tells us that there's some histamine-mediated pathology or symptoms going on, and then it's kind of up to me and the patient, or the clinician and the patient, to kind of determine, okay, is that a sustainable treatment plan? Mm-hmm. If you take one Zyrtec every day and that manages all your symptoms, okay, that seems pretty doable. We should still do the underlying work and kind of, optimize other things and hopefully decrease why your body is reacting in that way. But oftentimes, if the antihistamines are helpful, but they're not helpful enough, their patients are still having symptoms, that's where we might move on to more mast cell stabilizers. Mm-hmm.
Yeah. So that kind of leads me to my next question, which, because MCAS is mast cell activation disease, we start with antihistamines, mm-hmm. which is the thing that mast cells produce. Mm-hmm. And why don't we start with mast cell stabilizers first? Mm-hmm.
They take a long time to work.
Okay.
And
how long?
To really decide if it's effective as a treatment tool or not, probably 4 to 6 weeks. Okay. I always tell patients that mast cells are stubborn, they're trying so hard to protect you that they just do not want. And most times they really don't want to stabilize, and they don't want to stop dumping histamine because they really are trying to, not to anthropomorphize them too much, but
it's hard not to do that.
It's hard not to do it when you explain it to patients. But yeah, they take a little bit longer to work. Some of them are compounded, some of them, I had good luck getting covered by insurance, but that can always be a barrier as well, mm-hmm. versus an over-the-counter antihistamine. And there's lots of natural products on the market as well.
So what are some examples of some mast cell stabilizers?
Mm-hmm. And the more natural side of things, we have vitamin C and quercetin are mm-hmm. some of the big ones. You'll see a lot of products on the market that have a little bit of vitamin C, a little bit of quercetin, usually some NAC, sometimes nettles. Those are I'm not really the biggest fan of those products. I think if you have seasonal allergies, they're a great tool, but getting to a therapeutic dosage that's actually going to stabilize mast cells, you'd have to take way too much of them, and it's usually not a good fit.
Yeah, that was my understanding, is that you got to really dose it high to know whether it's working, and that might cause some side effects, might mm-hmm. not, but it can also be cost prohibitive for people.
Mm-hmm. Yeah, and it can be a lot of capsules.
Yeah, a lot of capsules. Yeah, chugging stuff all the time. What are some other options? Mm-hmm. What are other mast cell stabilizers?
Those are, technically there's a couple herbs that have mast cell stabilizing effects as well. We don't often use those in tincture form, just I think because the dosing could be somewhat prohibitive. Mm-hmm. But on the medication sides, the most commonly ones, cromolyn sodium is a big one, and ketotifen is another one. And then there's more, there are biologics and other things as well. And typically those are not the first line, or that's the next step to use, but.
Yeah, and my understanding is that cromolyn only works locally. Is that correct?
That is correct.
If you have maybe a lot of GI symptoms, an mm-hmm. oral form might be really helpful, but it might not treat the systemic mm-hmm. mast cell symptoms you're having.
That is true. It's a liquid, so it works by coating all the tissues it touches, and then it works, and then it's gone. So mm-hmm. it's pretty quick. They actually did a study. They found if you take it, most of it does come out in your stool. So it works while it's there, and then it's gone. So it is something you have to take. It's prescribed as 4 times a day, like before each meal and before bed. So that's kind of a lot. And it really is coating those tissues. What's nice, I have seen patients though, they do notice some systemic benefits from that, but typically I would reach for that first if someone's having a lot of GI mediated symptoms, or they make an awesome over-the-counter nasal spray that has cromolyn in it that I love. It's like $6. It works really, really well for like that local tissue inflammation and irritation.
Yeah.
Yeah.
Great. What's the difference between a mast cell stabilizer and an antihistamine?
Very, very different. Stabilizing the mast cells from releasing the histamine, I think you get a lot more benefit from that because histamine also triggers tens of hundreds of other inflammatory mediators and cytokines. So you're kind of like shutting down the storm at the start versus letting it happen and then just blocking as many receptors as you can to try and stop the feeling of those mediators. So you still have a lot of histamine floating around, but you're using a histamine receptor blocker, like you're still having that inherent inflammation happening.
Yeah.
And so it's a better long-term solution, I think.
Like a mast cell stabilizer
Yeah.
is. Yeah, that makes sense. Okay. Is it possible that a mast cell stabilizer will permanently stabilize a mast cell?
I don't think so. I don't think so. At least that's not what I've seen yet. I'd be very curious to see if that does exist. But I do have a lot of patients that things are really reactive and really inflamed. And once you can bring that dial down a bit, that is more of an environment that things are more likely to calm down rather than continuously reacting over and over. So I usually tell people, I'm like, I don't want you to be on this forever, but I think as a tool in the meantime, while we're working on underlying pieces and other things that could be contributing, makes a lot more sense to use a mast cell stabilizer than take, 6 Zyrtex a day.
Yeah, that makes sense. Now, what do you do if you try both antihistamines and mast cell stabilizers and they don't work?
If they don't work, I would really start to question whether that's the right biochemical pathway to be addressing, meaning like, are we missing something else?
Yeah.
Like, is this autoimmune? Is this something completely unrelated?
Yeah.
Or do we need to, get some more additional testing or get a specialist involved to be like, okay, what else is going on if it's not responding to treatment?
Yeah. And so is there like a stepwise approach you would do before you get to that point and be like, yeah, I definitely think we need to look into other options? Like, do you try the antihistamines first and then the mast cell stabilizers or like what?
That's kind of how most of my patients come in. They've already done the antihistamines or they've tried a little bit and they're like, maybe it didn't work or it didn't tolerate them. People with MCAS are very sensitive to dyes and fillers, and even over-the-counter antihistamines have dyes and fillers. So sometimes I'll have them try like the child versions. The liquid versions tend to be dye-free. There's like dye-free Benadryl, which is cool, just to test if that is the reason why. Those are probably the more very reactive patients. And if someone's on a mast cell stabilizer for a good amount of time, and there is dose range in there too, like some patients 1 milligram of ketotifen is enough to manage things. Some people need a little bit more.
Okay.
But if they've really gotten to a therapeutic dose and it's kind of like how much symptoms have improved, those ones are probably more mast cell mediated. But if there's other symptoms that are completely untouched, that gives us more of a clear picture on where we need to look for other diagnoses.
Got it. Okay, cool. Now, are there other kinds of like lifestyle changes or non-medication or supplemental options that can help improve histamine responses in MCAS?
Yeah, I've had a lot of patients respond well to the low histamine diet. Okay. I will say it's very restrictive.
It's very restrictive.
And I do not often, I provide the resources and I say, focus on the green, like all the things that you can have, but don't be overly restrictive.
Yeah.
Because I just don't think it's sustainable. But if you're in like an acute flare and you need to make sure that you're not, contributing, I think it's a valid resource to have. I don't recommend restricted diets in any.
Yeah, I know. I tend to stray away from them too because I feel like they cause more complications in the long term than benefit.
Yeah, I'm thinking about microbiome and gut diversity. Yeah. So that's certainly a tool that could be used strategically. I find there's oftentimes a large nervous system component to MCAS in terms of like that protection piece and that overreactivity. And a lot of my patients respond really well to things like acupuncture or limbic system retraining. Like basically there's so many different tools to explore that connection for people, and finding one that resonates for them, I think can be really powerful.
That makes a lot of sense. Have you ever used something like, have you ever done vagus nerve stimulation with?
Yeah, or like biofeedback
or
as
biofeedback.
well.
Yeah, and that can be potentially effective too. Yeah, that's really interesting. What about things like exercise and stuff? Is that ever helpful?
Exercise is helpful, but technically, like vigorous exercise can also cause mast cells to degranulate. So it's a fine, it's a fine line in terms of movement is helpful, but too much, your body will tell you pretty quickly.
Yeah, so I mean, we kind of have a protocol, somewhat of a protocol, but it sounds like overall it's more individualized to that person.
Definitely.
And there's not going to be like this kind of cookie cutter, you do this, and then this happens. It's kind of, well, we try a few things and see if that's helpful, and then try to adjust per that individual's needs.
Exactly.
Yeah, that's great. All right, well, thank you so much for this. This is an awesome series to do. I know we got a lot of positive feedback on it. And if anyone is interested in scheduling an appointment with Dr. Windsor, she's here at Aria Integrative Medicine, seeing patients with MCAS and all kind of chronic inflammatory conditions, GI symptoms. She does some women's health too. So if you want, you can call and schedule a free consult with her and just see if it's a good fit. Otherwise, just come and see her because she's pretty awesome. Thank you.
Thank you.